good afternoon to everybody. I'll pull up my screen and share it with you. And I'll start my presentation. So I'll speak to the guideline for Canadian drinking water quality for lead. That guideline was established back in 2019. So although it's new, relatively speaking, it's been around for a few years. So I'll give a little bit of a primer on the lead health effects. Lead's been internationally accepted as a non-threshold toxicant by many agencies, including Health Canada, the US EPA, and the Centers for Disease Control. So no safe level of lead in children's blood has been established. Lead exposure is associated with many health effects, but decreased IQ is considered to be the critical effect. And there's the strongest evidence for a causal effect there. Children were shown to be affected at the lowest blood level studied. So it's important from that perspective. As I said, our guideline for lead, we established a maximum acceptable concentration of 5 micrograms per liter, or 0.005 milligrams per liter. Some people call it ppbs. So that was established back in 2019. And in that document, we identified sampling for typical exposure at a populational level. And it also includes factors affecting exposure, some sampling considerations, as well as lead variability, which can lead to distinct types of lead, which are either particulate or dissolved in nature, as well as we've addressed some of the monitoring considerations in that document. In terms of exposure, lead in drinking water needs to be measured at the tap, and that's simply because the source of lead is not actually the treatment plant. It is really from materials that come into contact with water after it's left the treatment plant. In particular, lead service lines can contribute at least 50 to 75% of lead in the drinking water. As well, leaded brasses and lead solder can also be another important source of lead in drinking water, especially in buildings, and in particular larger buildings. And lead levels can be very highly variable. When you're looking at sampling for lead, those sampling considerations, will be based on whether or not you want to achieve a specific objective, because different sampling protocols will achieve different objectives. Some of them overlap, but for the most part, they all have a variety of ways that can be done and will give you different types of information. So again, you might have one protocol that might allow you to achieve more than one objective, but generally speaking, you're looking at whether or not you want to determine exposure, or if you're looking for sampling that will provide you some investigative diagnostic information, or treatment performance, or compliance, for example. Now, sampling protocols should also capture the variability of lead, because that exposure varies. That lead is it's not a constant, is not a stable type of thing for the most part. And you want to capture total lead, because you do get dissolved and particulate fractions of lead. In terms of sampling protocols and objectives, I've put together a little bit of this table that I pulled from the lead guideline. It's a little bit too detailed for me to go in line by line, but it just gives you an overview that, for regulatory compliance samples, you can use potentially a first draw type of sampling protocol, or a random daytime, or a 30-minute stagnation. And it will give you different types of information. Sometimes they're similar, but there's some distinct features for those types of sampling. So again, that is found in the lead document. If you want a little bit more detail on that, you can find that. In terms of factors that affect lead getting into the water, or lead release, as we call it, you can get dissolved lead release, and that's usually based on water quality, the surface area of the lead surface, so the pipe length and diameter, if you're looking at a lead service line, for example, and the amount of time the water will stagnate in the water. It's a little bit better characterized than particulate lead release. So particulate lead release comes from physical disturbances. So if there's hydrant flushing going on, road work, anything that vibrates a lead service, that can impact it. Lead service line replacement, if you're doing a full or a partial, the protective scales that are inside the lead service can come off sometimes, and they'll come off as small particles. You might get galvanic corrosion. So if you're getting the connection of two different metals, for example, example, if you're replacing one part of a lead service line with copper, but you've maintained that lead service on the other side of the connection, and that connection is brass, then there's galvanic corrosion that can happen there. You might get hydraulic disturbances and transport of those particles, as I mentioned earlier, those physical disturbances, but in this case it would be the water coming in at a higher pressure, or variable pressure, that type of thing. And then again, the stagnation of water makes a difference for particulate lead as well as dissolved lead. In terms of lead variability, the dissolved lead, as I mentioned earlier, is reasonably well characterized. We get a good sense of what will impact dissolved lead. Particulate lead release is pretty random in a lot of cases and mostly unpredictable. And it's usually particulate lead is defined as anything over 0.45 microns. It increases with stagnation, with a flow rate, with galvanic corrosion. It can be the main source of lead, or form of lead rather, in some cases, depending on what's happening out in your system. It's linked to lead spikes. So typically, not always, but typically, if you see anything above 100, 150 micrograms per liter, it's almost certain that you have some form of particulate lead in there. And it has some challenges with analysis. So you need to acidify the sample to make sure that it dissolves completely, so you can get an idea of what the total lead is in your sample. Now you'll see here in this, I'm not sure if that comes across, I guess not. I was trying to get my pointer to work. It doesn't work remotely, obviously, but the total lead will be made up of the soluble and the particulate lead. And what you see in that slide there is little particles. Some of it are just maybe little rust spots, but some will be is solder, some is other pieces of materials that are found sediment in the pipes themselves. So it can vary in size and look as well. Now, there's a correlation between particulate lead and other metals. So metals that can accumulate on top of iron and lead in the distribution system. And I think for the longest time, people assumed that when you had a distribution system, it was, clean pipe, nothing stuck to it. It was just sort of a transport mode. And it actually is a living sort of environment, if you will. You've got water going through there. You do have sometimes some biofilms when you're looking at cast iron that hasn't been lined, as in this picture here. That iron and manganese can form scales on there and accumulate lead. So iron is a really good absorptive material for a number of things, including lead. And if you get a release of those scales from either iron or manganese, either after a full or partial lead service sign, that can increase the amount of particulate lead you will see. So what we've been trying to communicate to people is that a red water or a discoloration event, so when the water's got a color to it, it results in the release of more than just iron, or it can include lead. So you need to monitor those events. You need to make sure that you don't tell people that it's safe to drink unless you've established that. So from a sampling standpoint, what does the sample result tell you? Well, it depends on how it was taken. So if you have a 6-hour first and second draw sample, it might tell you something very different from a 30-minute first and second draw, or a 5-minute fully flushed sample, or a random daytime sample, or a profile sample after letting it stagnate for 30 minutes or 6 hours. They will give you very different information. So overall, the conclusions of the sampling studies that we looked at to determine, what we would recommend within the lead guideline were that the fully flushed sample protocol is not representative of exposure. It's not to say you can't use it for other types of information, but for an exposure, it is not a good representative sampling protocol for exposure. A 30-minute stagnation can be representative of average exposure, and it's pretty reproducible under in this case, but it underestimates exposure. So it also represents average intra-use stagnation time. So, if you go away and you do something in the house and you come back and you use the water again, you let it sit for a certain amount of time. A 30-minute stagnation really sort of captures that. Whereas a random daytime sample is representative of average exposure, but it's less reproducible. So you need more samples. Because it is random in nature, you need that statistical power in order to get a good sense of what's actually happening out in a system. It does capture variability, but it tends to overestimate a little bit on the lead side, and it does represent also average interuse stagnation time, and it's more realistic because it's random in nature, and in a lot of cases the way we take water it can be pretty random as well. But you can't use random daytime and 30-minute stagnation interchangeably because they represent different things and they have different pros and cons. When you're monitoring, you need to address residential sites. So you need to look as a utility, you'd be needing to look at single family homes or multi-dwelling residences. You need to consider how practical or how acceptable that sampling protocol will be to your customer. It needs to include buildings and schools, and you need to because you need to capture that vulnerable population. There are different challenges associated with building in schools, obviously, and I think Tony will speak to those when he presents a little bit later, but you're looking at a number of fittings, faucets, bubblers, different types of what we call fittings in a building than you might have in a normal home. But any monitoring should also address the variability, the building type, seasonal differences you might get in occupancy and the water use. And you need to be really targeting your high risk areas or zones. So in terms of considerations, when you're monitoring your sampling type and locations and numbers, you need to identify those priority sites and locations. So home with lead service lines, whether they're full or partial, should be prioritized. And I'm talking at a utility level here, obviously. And you need to have guidance on site selection when you can't sample home with lead service lines. So you need to get a good representation of what that populational exposure is going to look like. So on the other hand, a protocol for large buildings and schools can be a little bit different. It's difficult to assess a representative sample in a building, in a large building or a school or that type of building, but it needs also to be practical and realistic for large buildings and schools in this particular case. So in the end, we've looked at all of those. We've made some recommendations for both residential and non-residential. We've captured residential with more than 1 unit, so it goes up to 6 units. And then once you're beyond 6 units, a sixplex, for example, then you would probably fall into more of a building type sampling approach. But the strategies for reducing lead will also vary according to the type of building and what the source of lead could be, could also drive what that strategy to reduce the level of lead that people are exposed to. For full lead service line replacement, where there are full lead service lines or service lines in general, that full lead service line replacement is the best approach, obviously, because you're removing the entire potential source of lead. Partial lead service line replacement can reduce lead, but it can also cause release of lead for several months, and most of that happens because of the particulate lead. And any reduction is not necessarily going to be a percentage of the line removal. So if you remove 50% of the lead service line, you're not likely to get 50% reduction in lead, simply because there's other factors that come into play in terms of disturbing the service line, potential galvanic connections, those types of things will also drive it to be a little bit higher than the 50%. In terms of corrosion control, for utilities, corrosion control may not be sufficient to reduce lead concentrations when the water is supplied through a lead service line, because you're looking at a significantly impressive, if you will, concentration of lead when you've got a pipe made completely of lead. There are other options that you can look at, if you're not attached to a lead service line, for example, but using low lead materials that comply with the NSF 372 or the 61 standards for plumbing and distribution system materials. So any fittings, faucets, that type of thing. And what we found too is that filters work very well, but they are a temporary measure. They're meant to be a quick, relatively inexpensive solution to a problem. If you're waiting to get your lead service line replaced, if you've got other issues with respect to lead, it is a good solution, and they work really well. Even before the standard changed to 5 microgram per liter, it was demonstrated that those filters were actually achieving reductions down to 5 microgram per liter or less, and more often than not, they were lower than 5 microgram per liter. So we have confidence in those certified filters. In terms of systems basics from a utility perspective, what we're trying to communicate is to make sure that you do a good characterization of your water quality, that you have an understanding of your pH, alkalinity, the cations, anions you might have, iron, manganese. All that is critical because it provides information on possible issues. It can inform the best strategy to use to mitigate the lead, the critical basic thing to do in terms of pH is to make sure that you measure that pH on site for accuracy, because it can be impacted when it's being transported and exposed to air. And you need to get to know your system materials. Are there lead service lines present? Are there galvanic connections? In your buildings, do you have brass fittings, faucets, valves? You know, what year were they installed and what chances are that they have a higher lead content than they might have at the current time? Some of the challenges that utilities or anybody who's doing sampling can face is that you have fewer resources to address issues. You might need a consultant or additional staff to be able to get a good handle on what that lead exposure could potentially be. In the case of utility, the footprint of the treatment plant might limit the corrosion control strategies that they can use, and training may limit options as well, whether it's a utility or another group that's looking at dealing with this. So treatment chemicals that can be used in a treatment plant, for example, if you don't have somebody who's trained to handle those chemicals, then that makes it a little bit more difficult. Adjustments to water quality can be a challenge if you don't have the right level of operator, and sampling capacity. Do you have enough people to do that sampling, protocol in the amount of time that you need to be doing it in? So those are some of the challenges that exist out there, and those are the things that need to be considered when you're looking at sampling plans. So in terms of small systems, there are a few key things that people need to think about, and that's manganese and iron removal have a huge benefit on so many levels. They make pH adjustment easier. It minimizes the accumulation and release of metals such as lead. It can reduce the disinfectant or the oxidant that you need to get your disinfection or your oxidation. Your chloride to sulfate mass ratio can also help you predict your galvanic corrosion. So even a small system can do those calculations fairly easily and be able to adjust accordingly. The detection of lead service lines can be done with simpler sampling methods. For example, sequential sampling, so taking several volumes one after the other is ideal, but a flush sampler can give you a good idea of whether or not you have a lead service line. It may not be helpful in other ways, but it will help determine whether or not if you establish a threshold, whether or not you have lead service line based on what you know about the system and the homes that you're sampling. And sampling plans, typically for larger buildings or for smaller systems, you need to think about covering more than 1 year to get all of your sampling done, for example. So in buildings, it may not be possible to do your entire building over a very short period of time. So you need to think about, okay, I'm going to do this many this year, this many next year, and then finish up in a third year, or, you know, you have to think about being flexible there. So all in all, that's what I have right now. I'll bring it over to Tony, and he can tell you his experience with the sampling that he did with First Nation Inuit Health Branch. Thank you.
Okay, great. Thank you so much, Franz. I'm just going to share my screen as well here. All right, hopefully you can all see that. Good afternoon, everyone out there. Thank you for joining the call today. And thank you for NCCEH for inviting me to speak today. So I've got lots of stuff to cover, so I'll just kind of jump into it and get through the material before we answer any questions that you folks might have. So this is just a presentation about the work we did back in 2018. And if you're like me, you define everything in relation to the pandemic. So it's like either pre-pandemic or post-pandemic. This stuff happened 4 years ago, so I really had to revisit our work and refamiliarize myself because it's been some time. So the overview of the presentation is just going to be listed here on the slide. So talk a bit about the role of the department in drinking water quality monitoring in First Nations, the purpose of our sampling survey, basically why we did it, and then how we did it, some of the challenges we came across, go over some resource demands of the region and of the staff, as well as some advice and lessons for other regions or other jurisdictions interested in doing something similar. So our program is a mandated public health program in First Nations, responsible for implementation and oversight of drinking water quality monitoring. So it's rather unique. In other jurisdictions, like provincially, for instance, the sampling is done by utilities and not directly by the public health department. The purpose of the monitoring program is to ensure safety of the drinking water and protect public health, achieved through sampling, interpretation, and data and reporting to the community. So we're really that final barrier in that multi-barrier approach in safe drinking water. Monitoring is done for all water systems, including public and private systems, as well as potable water hauling vehicles. And our routine testing looks at both bacteriological quality and chemical quality. So due to our regular sampling activities of all the drinking water systems in the First Nations communities, we did have a baseline data of all health-based parameters. So there was no lead exceedances or concerns related to lead relating to source water. And I think France alluded to this. If you see lead in drinking water, it's because it's coming off fixtures, solder, piping, and things like that. It's not so much related to the source water. We're not aware of any lead service lines in community. That being said, there's not a lot of good data or information that supports that either. But we believe much of the distribution infrastructure in communities was put in after the era of lead piping. So the project overview, we sampled all children's facilities, including schools, daycares, and Head Starts on First Nations communities in the Alberta region. Of course, children are at highest risk for negative impacts, and France went over those health impacts quite thoroughly, so I won't go too much into it. Our sampling survey was conducted during the months of May to June 2018, and that was a short timeline given the scope of the sampling survey and project. We did want to sample during the school year and during a time where it was the warmest. And again, the purpose was to conduct the sampling survey in anticipation of the MAC change that was going from 0.01 ppm to 0.005 ppm. And the objective was to screen children's facilities for lead in taps used for drinking and to establish a baseline of existing conditions, identify exceedances, and provide guidance on mitigation. Where there was exceedances, our EPHOs, our environmental public health officers, would make recommendations for remedial measures that would either try and reduce or eliminate the exposure. So the sampling plan, we sampled all outlets used for drinking and or cooking purposes in all those facilities I mentioned earlier. So drinking water fountains, kitchen taps, bathroom taps, home ec rooms were all candidate sample sites. The EPHOs consulted with facility operators and administrators to determine which sites needed testing. And we did utilize the random daytime sampling methodology for our initial sampling. This was the method that was directed to us from our headquarters in Ottawa. We call this Annex 5, this guidance document that was created. And it was intended to represent a typical exposure scenario with no prior flushing prior to sample collection. So just trying to simulate a situation where a student or a young person will go get water to drink from a fountain or from a tap. We sampled while the facility was in normal operations, again, during the warmest months where we would likely see the highest exceedances. 2 duplicate samples were collected one after the other from the cold water tap. And then the average of the 2 samples was taken to determine if the lead exceeded the anticipated change in guideline. We also implemented a resampling protocol as well. This wasn't detailed so much in the annex that we had, but we felt we needed a protocol to deal with situations where we found lead. So one of the things that we do in environmental health with BACT sampling anyway is, or even chemical sampling, is we'll resample something just to confirm that it's there and then decide what to do from there. So random daytime samples that exceeded the proposed MAC were sampled again after a 30-second flush as well as a 2-minute flush. And the purpose of the additional sampling and rationale was, again, to determine and to confirm that there was lead exceedance, to provide some insight to the facility and to the nation as to where lead might be getting into water, whether it's a service line, potentially, or the fixture, or an upstream piece of plumbing that's inside the building. And we concluded if the 30-second flush exceeded, but the 2-minute did not, it was deemed to come from the fixture. And if the 2-minute flush sample exceeded, but the 30 flush did not, it was deemed to be an upstream source. We based this approach on the EPA 3Ts documents. There is a flush sampling protocol that we reference and use for guidance in this approach. So all told, we sampled from 1,422 sampling sites in the region. These samples came from 132 different facilities, and we observed 239 or 17% come back with exceedances based on random daytime sampling. And then we resampled all the sites. So there you see 239 came back with initial exceedances. All of those were resampled, and an additional 41 came back with lead in the follow-up sampling. Total number of all sampling points with confirmed lead exceedances was about 3%, or 41 sites out of the 1,422 that were selected based on the surveys and the assessments done by the EHOs. So where there was no reported exceedances, no reported exceedances that were in the order of magnitude that represented an acute health risk. So we did not come across any, vastly and astronomically high levels of lead in any of our sampling. So that was a good thing. That might represent an acute risk. And in most cases, exceedances, it was concluded that it came from the fixture itself rather than the building plumbing system. And each of the facilities was dealt with uniquely and based on consultation with the administrators and the EHO for that community. Some of the tools and technology that we use. So we sent all our samples through the ALS laboratory. That's our contracted service provider. We also utilize a product from Palin Test that provided on-site testing for lead analysis. This was done in supplementary to the lab, the use of the lab. So it was able to provide immediate on-site results based on remediation that had been done, whether it was changing a pipe or changing a fixture. And we also sent a set of samples to the lab to verify our findings as well. Staff all GPS the sampling sites. We collected our information on our Surface Pro tablets, and information was collated and compiled and stored on our SharePoint. So once we had the results, we had to communicate them. Prior to the sampling activity itself, we made sure to inform the communities that we were sampling lead and why we were doing it. That was really important to us. So we're being transparent and making folks aware of what we're doing and why we're doing it. Once we had the results, we sent them out to the communities with interpretation and recommended remedial actions where appropriate to all community contacts. We engaged with our colleagues on the other side of the house, so to speak, with Indigenous Services Canada, called Regional Operations. They're formerly known as INAC, or Indian and Northern Affairs Canada, and they're more the capital infrastructure funding side of the ministry. And work closely with regional communications personnel to develop media lines in case they were needed. Sample sites with no exceedances, we still informed the communities that these are the results and that no remedial action was required. And we shared an information pamphlet that basically detailed what we were doing, why we were doing it, and some information on the upcoming changes to the guideline. Sample sites with exceedances after resampling. So these are the ones that we're most concerned about. We're provided guidance on short and long-term remedial measures to reduce lead exposure for that particular sampling site. So short-term and immediate mitigation strategies included things like turning off the water valve so the water could not be accessed by a student or a young person at that particular fixture. Signage to inform users that the water was not for drinking and only for hand washing. Another strategy could have been implementing a flushing program to the affected facility and or fixtures, using bottled water for drinking and cooking purposes, and where appropriate, working with the water plant operator to control corrosivity of the water. However, I don't think that last strategy was employed in any of our cases, but it was considered as a potential option. The more medium and long-term mitigation strategies included identifying and replacing lead-containing faucets or fixtures with lead-free materials. So that was probably the most common mitigation practice that was carried out in these facilities. We wanted to make sure that they were installing point-of-use devices. If they were going to go that route, that met the NSF standard for removal of lead. And then the EHOs were also available to conduct follow-up sampling and interpretation following remedial work. So not just going out and doing the sampling, finding an issue and just telling them, what was wrong and how to fix it, but we're there to provide support from a public health perspective, information, resources, directing them in the proper direction, and also conducting follow-up sampling where work was done. And the program still remains available to communities that need our support or guidance on addressing lead fixtures in their communities. Oops. Just a bit on stakeholders. So the folks that were, a part of the survey, that needed to be a part of the survey, including, of course, the First Nations communities themselves. We work closely with the health directors and public health staff, public works as well, school administrators, First Nations leadership in the region, namely the Health Protection Subcommittee of Health Co-Management in the region, and the Assembly of Treaty Chiefs, the AOTC. We had to work closely with our partners on the capital side of the house, as I mentioned earlier. So folks there that would be a part of those conversations, including the education department, as well as capital program that's responsible for water and wastewater. And I'll get into a bit of why that was really important for us to keep in communication. Regional communications as well. So helping draft and develop effective media lines in case they were needed. Regional senior management certainly had a keen interest in what we were doing, what we were finding. As with all environmental health issues, we're always engaged with our medical officers of health as well, just keeping them abreast of what we're doing and what we're finding in case there were community questions, medical questions, as well as our internal data team, who was really instrumental in helping us get the data, compile the data, and interpret it, and then send it out to the communities in a timely manner. So back in 2018, following the prolific water crisis in Flint, Michigan, I think there was a sensitivity in the public to lead. So having proper communication was really important. We certainly didn't want to downplay the risk of lead in drinking water. At the same time, we didn't want to cause too much alarm and panic as well. So the department program was required to ensure all tables of leadership were informed of the sampling program, the findings, as well as the follow-up plan. So really, in a lot of what we do in environmental public health, risk communication was and remains paramount, and just being able to balance, the community concern around lead and kind of the media coverage around lead with the actual risk based on the findings was definitely very important. Some of the challenges we came across, development and completion of pre-sampling surveys at all community facilities. So before deciding where to sample and how to sample and all those things, we needed to go out and do a assessment of all of these 132 buildings in First Nations communities. So this took a bit of time doing pre-sampling surveys, identifying the sites that needed to be sampled, meeting with administrators and teachers and other personnel as well to make sure that we're capturing the sites we want to capture. We need to develop a results management plan So it's one thing to go out and sample and get results from 1,422 sites, but how do you manage this data in an effective and coherent manner? Again, that's where our data team was really invaluable to us. We also had major delays for the contracted laboratory. They had a lot of capacity issues. We had a shortage in bottle supply and reporting as well. I'll just show you a graph a little later, but just to highlight some of the challenges with respect to the lab and our sampling and reporting delays. We had a short timeline, as I mentioned, May to June. Not a lot of time to complete this. Regionally, I believe we were told to get this done basically ASAP. So we try to do it as quickly and timely as possible, understanding that the changes to the MAC and to the guidelines were coming. So we wanted to be ahead of that and have a picture of where things were at in these facilities well ahead of that. And then mentioned the annex that we were using didn't have a follow-up sampling protocol. So we were responsible for kind of coming up with our own approach to that. This is the graph I mentioned. So the blue line is just when the samples were taken. So all our sampling got done, and then there was a huge lull for a few weeks there. And then we got results trickling in. And then we saw a huge influx of results right around August, towards the end of August 2018. So that made it challenging to our data folks to capture and collate all that data and get it properly inputted, so our EHOs could communicate it out to communities. So if it had been more of a steady, static response from the lab, it might have been less stressful, but we did have to handle a lot of data in a short amount of time. So like I said, the issue around lead in drinking water, just drinking water in general on First Nations, right? It gets a lot of attention and both media as well as from communities. So when we started reporting our results, there definitely was a small uptick in community concern with lead. So they started approaching our partners over on the regional operations side, basically demanding money to replace plumbing for entire schools. So you can imagine those folks were a little bit taken aback by that. It would be a huge capital cost to do across the region. So they were quite concerned in terms of what we were doing and why we were doing it. And they also felt we weren't keeping them informed, despite our efforts to communicate well ahead of the survey to tell them what we were doing. So that did lead to some frustrations on both sides of the house in terms of the ministry and the region. And then really quickly on resource demands. So it was not a simple and quick task. It was an all hands on deck approach. All the EHOs, our data team, our admin team, we had summer students and members of the management team were all involved in completing this project and really speaking to it, answering for it to senior management and to the other tables. Yeah, so I just broke down the number of hours, approximate hours spent on the project. Most of our time was spent on pre-sampling surveys and the data management side, as well as travel. So we do support all 45 communities in the region. Some are quite remote and take a lot of time to get to, so travel was a definite factor. So all told, 1,920 or so man hours dedicated to completing this survey during that time period of May to June 2018. And then to finish with a few slides on just lessons. So if jurisdictions or regions are considering doing this sort of survey, just something to think about. So triaging and pre-sampling visits to all facilities needs to be done. So meeting with administrators, figuring out where you want to sample so that when it comes time to sample, it's a quick and easy process and there's not a lot of fumbling around and wondering what to sample, what not to sample. So having that established is really important. Developing a rigorous data management plan as well, ensuring good communication with the lab to avoid issues like we encountered, to develop a follow-up plan should you find exceedances. So again, just being able to provide a characterization of the risk to the communities and provide guidance on what to do. I think it's really important to have that plan in place. well ahead of the sampling survey itself. And of course, communication, remaining engaged with stakeholders. I mentioned regional operations, especially regarding facilities or communities of concern. So, for example, if it's if it's a high school and you're seeing 10%, I'm just kind of putting a number out there. If you see 10% of samples come back high, that's going to be a concern for that community, and they're going to be kind of raising alarms about that. Regional communications and medical officer of health to inform on messaging, and following up directly with facilities and contacts where exceedances were identified. So we feel this was very, very important, just taking the time to properly characterize the risk and communicate risk to minimize panic and alarm, so that the issue can be addressed and mitigated without people getting too alarmed. Practice effective risk communication, especially with perceptions of risk, and I mentioned how prolific the lead issue is, or was, or is, with respect to the Flint, Michigan situation. And then just a huge thanks to my team here. That's our team of EHOs on the left-hand side, who carried out the sampling, reported the information, interpreted the information, and guided First Nations on how to address issues where they were discovered. And then our data team on the right-hand side there, who were instrumental in making sure that we had the information we needed to be effective in reporting and interpreting our results. So, thank you very much.